Have quorum.
Okay, great. Thank you. Good afternoon, everyone. Welcome to the Regional Domestic Violence Council meeting. Let's call the meeting to order at 2 p.m. This meeting is being recorded and live streamed on YouTube as a way for members of the public to participate. I will ask that you keep your microphones on mute when you are not speaking. And for the purpose of the meeting minutes, I ask that you state your name before any comments. For action items, we will be taking a roll call vote. I will ask staff to call out the council names and then ask how you vote. Unless there are any questions, we will move on to the next item. Okay. All right. This is call to the audience. Please note that members of the public were given an opportunity to submit written comments relating to this meeting to azmag.gov/comment within 1 hour of the posted start time for the meeting. Kelly, has staff received any comments from the public?
No, Madam Chair.
All right, thank you. Then we will continue to next item, which would be item 3, approval of the August 19th, 2021 meeting minutes. Is there a motion to approve the meeting minutes?
Bridget Peterson, so moved.
Okay, is there a second?
I second it, Madam Chair, Councilmember Christine Ellis.
Thank you, Christine. Is there any discussion before we vote? Please indicate your vote with a yay, nay, or abstention. Kelly, please conduct the roll call vote.
Celeste Adams.
Yay.
Councilmember Bandon.
Yay.
Councilmember Caputi.
Yay.
Councilmember Ellis.
Yeah.
DC Ernst.
Yay.
Councilmember Friedel.
Yay.
Laura Guild.
Yay.
Mary Lynn Kucinich.
Yay.
Kasinick, pardon me, Kasinick.
Yes,
I will learn how to say your last name. I apologize. Rick Lavis. Mayor Peterson.
Yay.
Kelly Shore.
Yay.
Melissa Thomas.
Yay.
Have I missed anyone? Yes. Ms. Offenberg.
Yay.
And Madam Chair, how do you vote?
Yay.
Have I
Thank-
missed anyone else?
Yes, Samantha Hinchy from ACES DV,
Thank you.
and yay.
Okay, thank you. The motion carries. We'll continue with item 4. I would like to introduce Laura Guild with DES to offer an update on the important partnership to address abuse of older adults. Laura?
Thank you, Madam Chairman, members of the council. I'm here today representing Jody Hector, who is the program coordinator for the OVW Office of Violence Against Women grant for abuse in later life. It's a county-wide consortium that DES has initiated after receiving a grant from the Department of Justice Office Against Violence Against Women. In the last meeting, I believe I presented on sort of what we had accomplished up to this point, including the results of a needs assessment. So all we need to do today is just give you some quick updates. I do want to let you know that that we are now considered to be a coordinated community response team that's made up of members of Maricopa County Sheriff's Department, county attorneys, the victim services represented by the Area Agency on Aging, Maricopa County Association of Governments. We've also brought in members from the City of Phoenix Family Advocacy Center, from the fire department, thanks to DC. We have a new individual representing Adult Protective Services. Oh, and it seemed like there's one more that's slipping my mind right now. And so we are growing, which is great. So what Jody prepared a quick list for me to share with you. We submitted the needs assessment and our strategic services plan to the federal government and are waiting for their approval. Once we've received that approval, then they will release funding into the contract that we can use to assist with victim services. And based on the needs assessment, it was determined that an unmet need was for having a more active hotline or call center, and for victim services for a housing specialist that would be located in the Area Agency on Aging, the DOES program. So we anticipate receiving approval for that and be able to move forward with that into the second year of the grant cycle, which started October 1. The next thing on the agenda is a grant kickoff, which is scheduled for November 18th. That will include the members of the CCRT, a national organization called the National Clearinghouse for Late Life Abuse will be conducting the meeting, hosting it, and they will be presenting to the partners on the CCRT sort of the outlook for the next couple of years, what they're hoping will be accomplished, and meet the members of our team. So that's coming up in November. Then we'll be starting in the near future, sometime in 2022, specific trainings that again will be hosted by the federal government and the National Clearinghouse for Late Life Abuse, to train the trainer in the area of law enforcement, prosecutors, and judges on the issue of late life abuse. Once those trainings have been conducted, then members of that team will come back and do trainings locally, which is all part of the overall project of the grant. We are working on building relationships and reaching out to victim services. We continue to have monthly meetings for all of our partners. And we want the individual that's joining us from APS in our CCRT actually is an expert in financial exploitation. So we will be able to build our awareness and understanding of that issue as we move forward.
Laura?
Yes.
I hate to interrupt you for a moment. Are you all hearing some background noise of people talking? Is that in your office, or does someone, I'm looking and I don't see any microphones on.
I've got my headsets on and my microphone and I'm plugged in, so I don't, but there are people in my office. That's all I can say.
Oh, okay, that it somehow must be coming through. Okay. All right. If anyone else, I see everything else looks like it's muted, so. All right. Can you hear it? All right, go ahead and continue, and hopefully that will.
I apologize. I wasn't aware. And actually that concludes, and I can take any questions or comments.
Are there any questions for Laura or comments? Thank you, Laura, for your presentation. We're committed. Yes.
I'm sorry, I just had one question. Laura, how are you guys how are you going to go about getting judges and prosecutors to, like, how are you going to do that training? Are you going to go through CIDBIC or just reach out to them? Just curious.
Well, the prosecutor's office is an MOU partner. So when we wrote the grant, they committed to having designated people that will do attend the national meetings to do the training, and then come back and train their staff, their officers there. The judges is something that we haven't explored yet. So that's down the line. We don't have an MOU partner from the courts yet. So the training will be done by the federal government through NCAL, and the information they give us is what we impart on the local level.
Thank you.
Thank you, Laura. I have a question. Are there other agencies outside of our jurisdiction that are utilizing this? You said the federal government will be helping with the training. Are they doing this elsewhere?
Laura, you're on mute.
You're still on mute.
No, I'm not.
There you go.
No. So are you asking where the training is going to be conducted?
Well, you said it will be federal, the federal government will be doing the training. So are they doing this training already somewhere else as well?
Well, the original, this grant has been in effect for 10 years, and they all over the country. The process was always that members of the MOU teams went to Washington and received, over a 3-day period, received this intensive training, all of the MOU partners. Now they had to pivot, obviously, for the pandemic. And the last year they did it virtually, and they're still determining whether 2022 training will be in person or virtual. It's not known yet.
Okay, thank you. Any other questions for Laura? Yes.
Councilmember Christine Ellis here. I have a question for Ms. Laura. Ms. Laura, you mentioned that you do not have a relationship with the judges yet. I know in Chandler, our magistrate, Judge Coupin, is very a forward thinker. Would it be okay if I could put you in contact with her to see if that's an avenue you can start to explore coming out of our courts here in Chandler?
Absolutely. You can send that information to me through Kelly will be able to get it to me, and then I'll forward it to Jody Hector, who is, as I said, the new program coordinator, and can contact the judge. Yes. Yes. Thank you.
So
Thank
much.
you for that.
Ms. Kelly, if you could please send me an email with that information, and I'll have my assistant send that immediately to you.
Yes, council member, I'd be happy to. Also, Madam Chair and Laura, we do have to be able to attend your meeting. Thank you.
Thank you. Any other questions? Okay, thanks, Laura, for helping us with this, and we're proud to partner with you on such important work. Right? Okay. We will continue with item 5. Randy Haid, Director of Evaluation Impact with UMOM, New Day Centers, is joining us today to offer a presentation on UMOM's work in providing shelter and housing to families, including those fleeing domestic violence. We are thankful to Randy and the team for their efforts. Randy, the floor is yours.
Thank you, and good afternoon, everybody. Am I coming through okay?
Yes, Randy, thank you.
Great. So today I want to focus less on UMOM itself as an agency and more on UMOM's role working with the Family Housing Hub. That's the family lead operating agency for family coordinated entry. So we provide connection services for a lot of family service providers, family homeless service providers here in the Valley. We do a shared shelter wait list as well as referrals into housing programs from there. So I'm going to focus here on the family coordinated entry piece and the Family Housing Hub's role to be considered part of the family system as opposed to singles homelessness. You would need a dependent child under the age of 18 in your household, and then also, or a single woman who's pregnant or a family who's pregnant. We work to find the right resources for that as well. I won't really go into coordinated entry, an overview of coordinated entry as a whole, if that's okay with everybody. I'm going to focus in on how that overlaps with how we serve individuals, well, families, how we serve families that are fleeing domestic violence situations, and go from there. So there's 3 main pieces I'm going to cover. And that's when the Family Housing Hub, when our coordinated entry points identify a family who's fleeing, how we work with families that are already in DV shelters to connect them with housing resources in our coordinated entry network, and then how to refer a family to the Family Housing Hub if they are in a housing crisis and do not have a safe place to stay and need shelter or related services. And please interrupt with any questions as we go. I'll go ahead and do next slide, please. So first up, when the Family Housing Hub identifies a family who is fleeing, This happens in conversation. These are private conversations that we start out with in our screening. And so they'll share with us their safety concerns or a situation related to safety. Our first questions are around if they've contacted Safe DVS already to pursue shelter, to pursue that DV shelter, that more confidential shelter option for people in that situation. As I'm sure you all know, our experience is that Safe DVS is very busy looking for shelter options for families, as well as we are, unfortunately, right now, since the moratorium lifted. So we make sure they're connected with Safe DVS either prior to seeing us or immediately after. And then if the family does not have a safe place to stay, we screen them and get them onto our shelter wait list. To find homeless shelter as soon as possible. We encourage them to still work with Safe DVS for DV shelter. And then at the same time, we're also screening them for housing options. Those are slower. We want to get people out of their crisis situation and into shelter as quickly as possible. And usually the housing is slower and will come after that. And then part of that conversation is we do make a safety plan. If we can't get Safe DVS on the phone to help us walk through it, we make a safety plan, and then we do referrals to community-based services depending on the situation and the need. So that's the gist of what happens when a family identifies to us that they're fleeing. I'll do a quick overview of coordinated entry. So we do a shared shelter wait list. We have now 5 family shelters with a 6th one that works with us a little bit. And we then have a handful of housing interventions that are connected to it after that. And we help connect people through that network to find the right resources to end their homelessness if the resource is available. Of course, that's always the hard part. I'll pause for questions if there are any.
I have a question, Randy.
Yes.
On the wait list that you have, typically, and I know it can vary depending on times and so forth, but what's the average wait that these people have before they can get in?
Yeah, and it does vary quite a bit. So there was a moment during COVID where we were extremely low, but our average over the last year is 6 weeks, a 6-week wait, with it climbing now that the moratorium is lifted, unfortunately.
So you mentioned there are 5 family shelters. Do you know about how many people those shelters can provide for?
Not off the top of my head, but I would guess around 250 beds at a given time.
Okay, all right. And so if the wait time on that list is up to 6 weeks, is there emergency shelter or something? I mean, if they're fleeing and they're homeless, it's a 6-week wait. What do they do?
Right, and that's a great question. DV or a homeless situation where they're sleeping out in their car, we prioritize those in unsafe situations. A high priority, people who are doubled up, maybe have a safe place to stay temporarily, we do a lower priority for shelter. But yeah, that is a serious situation that we're trying to bring on more shelter beds or help our outflow from shelter to move people through shelter more often. We work on a crisis plan with people to help them try to identify some places to stay or try to stay safe as they're working through it. Obviously, we encourage them to do Safe DVS's process, which I think is like call back every day or something like that until you can get in. So yeah, that's not a good answer because we don't have a good answer right now, unfortunately.
Okay, thank you. I guess I'll just follow with one more question. Since that is an urgent need and we basically we're lacking in shelters, what kind of efforts can we put forward to get more more shelters? Churches or what? I mean, are there some ideas and things that are being done that maybe some of us can be involved with or do something to help create more places?
Yeah, that's a great question. I would be, from this particular angle, I would be interested to see what if Safe DVS or the coalition of DV shelter providers, if they're working on anything for helping victims. On our end, though, for more general housing crisis, we're onboarding a new shelter that was funded by the city of Phoenix. That's Homeward Bound, is transitioning some of their units over to shelter. So that's helpful. Other than that, running shelters are pretty expensive. So we'll advocate for more resources for shelters, certainly, but what we found is a more economically viable and flexible option is to improve the rate at which we can move people out of shelter. So that one shelter bed can serve 8 families in a year instead of 4 families in a year. And so that's trying to make sure we have good housing options, or move out assistance if a housing option is not available, strong case management in shelters, as well as trying to connect with community resources that maybe aren't as embedded in our network as possible. Homeless prevention is one of them. We can move more homeless prevention resources into that front end of the shelter waitlist, as well as we know that there's other programs out there that are serving homeless families, but are maybe not doing it formally through our network, and we could speed up the connections and the eligibility process by onboarding them. And that's sort of our bigger strategic goals around that.
Right.
Those are all slow answers though, and this moratorium lifting, at least what is correlating with the moratorium lifting, is hitting us pretty hard right now.
Mhm. Yeah, thank you. Yeah, there's no easy or quick fix.
Yeah.
Does anyone have any other questions?
So this is Celeste Adams from Save the Family. Not so much a question, but I second that, what Randy is saying. I work in similar with you, Mom, in housing, and it's the lack of affordable housing. There's a backlog and a front log in shelter services because the prices of apartments and the strictness of who they'll allow into those apartments has just skyrocketed the last 2 years. So if there was 2 kind of areas where we need to probably put a lot of effort into, somewhat into more shelter beds, but really more into affordable housing. Arizona just has not enough. And that really causes safety issues for people that are trying to escape those situations, because that's a lot of what goes through their mind before they leave is, I can get to a shelter, but where am I going after that? And what's my financial viability after that? And that's a real question a lot of survivors are asking.
Thanks, Celeste. Yeah, we get families approved for a rapid rehousing voucher. That's almost the easy part nowadays. But if they can't get approved, despite landlord incentives now being pretty available, then that prevents that opportunity from actually coming into fruition, unfortunately. And we can talk a little bit more about housing interventions on the next slide. Okay. So sometimes we'll connect with a family who is already in DV shelter. And so that's great. We're not going to look for shelter for them, but we do still want to connect them with the same set of housing resources as if they were in a regular homeless shelter, plus actually a few bonus projects that are through our network. And so when somebody comes and visits us, usually it's the DV shelter staff that are making that connection or referring them down to us. And so they're visiting with a little bit of background info. We do the assessment to figure out the right fit for the resources. And then we do a general housing plan. Like we said, just because you got scored for and are eligible for a resource doesn't mean a vacancy will become available. So we talk to them about some other ideas and community referrals, and absolutely we get them started on documents. That's a big one. Those can be slow, especially out of state. So we ask that the DV shelter case managers also really work on trying to get documents when possible. Easier said than done in some cases. And then we connect with shelter staff. We finish up our work with the client. We ask them to sign a release of information so we can communicate with the DV, with their DV case manager. And we send an email to both the case manager and the client with, hey, here's the plan we talked about. Here's some resources for your reference, and to contact us with any questions, either client or case manager. And then we ask, if we don't have it, we need that letter of residency. That's how a lot of our housing programs are gauging eligibility, is confirming that they're homeless and in a DV shelter. So we ask for that, and we try to get that from the DV shelter. And then later, when the housing resource becomes available, let's say, 2 months after that, the family's, been in DV shelter working their case plan, but we have a rapid rehousing vacancy available. We do that connection. The client doesn't, we're doing that connection in the background the whole time. A rapid rehousing programs email us and say, hey, we have 10 vacancies, and we connect 10 appropriate referrals to them. And then they call the participant directly, or the case manager if they can't get a hold of the participant. Those in DV shelters are eligible for everything that another homeless family would be eligible for, except there are 3 projects that specifically prioritize those in domestic violence or fleeing type situations. And so luckily, lately those programs have had, I don't know if it's been a grant cycle starting over or what, but they've been taking people in pretty quickly to the point where we've been housing folks in DV situations or in DV shelters much quicker than we are able to connect the general population with housing programs. That's mostly situational though, so yeah. Next slide, or let me know if there's any questions. Uh-oh. So could you maybe hit, it looks like there's some weird, yeah, sorry about that. Go ahead and go to the end. Okay, so this is a rough overview of the process. It's 3 stages. We connect with families at the entry point. We try to get them into shelter as quickly as we can, or in the case of DVs, they're already in DV shelter, in which case we don't look for shelter for them. And then we connect people with rapid rehousing or housing interventions in general. You can see that that's mostly mostly rapid rehousing, excuse me. The size of the circle correlates to the volume of people these programs are serving. As far as connected with us, right? I'm sure there's many DV shelter residents that don't connect with us who are being served. They're not showing up in this. This is just when they connect with our network. So as you can see that on the far right, only 20% of that original 100% end up connecting to a housing intervention. That's okay. We don't say that everyone needs a full housing intervention. We would like it to be more than 20%, though. So this is a general overview. This is my mental map of how the system works, as these 3 main parts is this light touch crisis service happening at entry point, connecting people with shelter, which is typically about a 4-month program, case management, you know how it works. And then connecting then when available to a housing intervention, rapid rehousing being that 9-month, 6 to 12-month intervention, permanent supportive housing being permanent, and transitional being generally 1 or 2 years from there. Any questions? Next slide, please. And referring a family to us. So whether it's a family in a shelter who wants to connect with housing resources, or a family who needs shelter, and we want to try to use our network to get that. During COVID, we switched and we're offering 100% of services over the phone. So it's a phone call. As I mentioned, we are experiencing really high volume. So we're not getting around to screening everybody in the same day they call, but it's within the next day usually. I sent, I believe I sent over, Kelly, I think I sent over a flyer, so that might be attached in the materials. But otherwise, you can visit fhhub.org for exactly the same sort of info and download the flyer as well. Service provider staff, if you have questions, sometimes coordinated entry can be confusing or even frustrating. I will admit that. So if there are any questions whatsoever, we encourage case managers to reach out on that connection email that we make with the DV shelters. Or if you're not necessarily in that situation, you can contact our general manager, Anna, who many of you know and have worked with. And she will work through whatever the problem is. And then, of course, if you are a service provider who is supporting a family who's in a DV shelter, or you're doing maybe community case management and they are waiting for an intervention, we see documents and letters of residency really slow up the process, where, like Celeste said, you know, there's lease up is another part of the process. That's affordable housing is slowing it up enough as it is. So really working on those documents right away to get approved for apartments. We encourage all service providers to help us in that endeavor. Next slide. And that's everything I prepared for you all today. If there's any last questions, I'm happy to answer those. And
really quickly, I'm so sorry, you might have answered this in the beginning, but can we get a copy of these slides, like the PDF? Just because like I would also like to look at the mental map a little bit more.
Totally.
Thank you.
Madam Chair and members of the committee, I would be happy to send out today's slides after the meeting.
Thank you.
Thanks, Kelly.
Members of the committee, do you have any other questions? All right. And Randy, I do have one more, and we probably know the answer, but with COVID for the last 18 months, has there been an increase in the number of DV situations with children involved where they're seeking shelter? And if so, do you have an average of age, or is it all ages? What's happening with that?
Yeah, a great question. So because we use the HMIS software, we're a little limited in like the sort of depth of information we retain on DV participants. So I don't have any of those specific answers. I do know in general, we saw a huge downturn in the demand for shelter during COVID, presumably because of some of the government benefits and the moratorium. We saw we saw the lowest shelter wait list we've ever seen, and generally lower demand across the board basically the entire 18 months. And I could be wrong, but I think at least early on, I heard that Safe DVS was maybe experiencing the same sort of lower volume, but I definitely don't know enough to speak to that overall.
Okay. That's interesting, because my understanding is actually cases went up, but yet the calls for shelter went down.
Right. Yes, that was our experience. That absolutely did. We wonder if people weren't comfortable going to a shelter with a contagious disease going around, which makes sense. So that might have been in part of it.
Right. Okay. Thank you. Have we received any comments from the public on this, Kelly?
No, Madam Chair, we have not.
Okay. Thank you. Thank you again, Randy, for
Excuse
presenting.
me. Hi, I'm Tricia from Chrysalis. And I just want to state, when we're talking about all these numbers and being able to fill the beds or not being able to fill the beds, we have to keep in mind that especially with COVID, we had to practice social distancing. So we were not able to take as many clients in residential as we would normally. And so that has impact all the way around. And I'm sure other shelters, whether they're homeless or domestic violence, probably felt that same impact.
Right, yes. All right, thank you, Tricia. All right, well, again, thank you, Randy. Are there any other comments? Okay, thank you, Randy. And then we'll continue on with item 6. All right, and with that, I'm pleased to introduce Michelle Gennaro, Director of Child Help, to share their work in domestic violence services for children and families. Michelle, the floor is yours.
Wonderful. Thank you, Madam Chair and members of the committee. I appreciate the opportunity to talk with you about our Children's Center of Arizona. We can go to the next slide. So the Child Help Children's Center of Arizona is a child advocacy center. Child and family advocacy centers are defined in ARS 8-466 as one-stop service locations for child victims who need help and support. It's based on a model using a co-located multidisciplinary model so that child victims are served, their crimes are investigated, and the healing begins. And it's a partnership truly between law enforcement, healthcare, behavioral health, child welfare. And this multidisciplinary model is what is really critical in terms of being able to meet the needs of the child and their family when a crime has been identified. Next slide. There are currently 19 child family advocacy centers throughout Arizona, and there's predominantly 3 models. There's the nonprofit model, which is Child Help's model. Amberley's Place is a child advocacy center down in Yuma. There's also models of municipal police departments such as Mesa, Scottsdale, and Glendale, as well as a model through a hospital system up in northern Arizona. There's also a statewide association of child and family advocacy centers in Arizona called ACFAN that the majority are all members of that can identify and talk about issues, barriers, as well as best practices and training needs. Next slide. So each county, hopefully most of you know, does have a protocol for the investigation of child abuse. I understand these slides are being shared, so I also included a link for the Maricopa protocol that was last updated in 2016. And that protocol is really critical in terms of defining the roles of all the partners, as well as identifying the process for the investigation of child abuse and the number of interviews that children are going through, recognizing the importance of not re-traumatizing a child and having them go to multiple locations. And so that protocol also supports an effective and consistent way of investigation, prosecution, and management of the child abuse cases. And it truly does ensure that the child is treated with fairness, integrity, and respect based on whether it's a one-time event or chronic abuse that they're going through. We also have in Arizona, as you know, mandated reporting, which is very critical to identifying children who have been abused or where abuse is suspected. Next slide. So just to give you an overview of some of our numbers, I gave you both 2019 and 2020 as we are in a pandemic to really understand the impact, but also the recognition of, as we all know, the violence and abuse did not stop because of the pandemic. And for a lot of children and families, it may have become very difficult to seek services or have reports made, particularly for children, where a large number of reports come from schools. And so when they weren't in schools, there were no eyes on the child. What we found, which is not specific in these statistics, is Child Help is a national child abuse hotline. And while reports to Department of Child Welfare may have gone down, calls into our hotline increased by over 30%. So it demonstrated the critical need and supports that our children and youth we're in need of. So here at the Child Help Children's Center of Arizona, we are the largest advocacy center in Arizona, serving, located in Phoenix, but we do serve all the municipalities, as well as the FBI and Bureau of Indian Affairs. In 2019, we were serving almost nearly 600 children a month. In 2020, it was about 400. We had about 3,009 new clients come through in 2020. We provide multiple services that include therapy, which I'll go into more detail about, forensic interviews, victim advocacy services. And so you can see a significant amount of services provided with our multidisciplinary partners to support the healing of children in the investigative process. One of the critical aspects of a child advocacy center is bringing the multidisciplinary team together on a regular basis to review cases, to talk about what's working, what is not working, where things might be stuck in the investigative process, and bring the partners together to really talk these through. So we facilitate meetings here at Child Help twice a month, but we also facilitate those in the city of Mesa, Chandler, Scottsdale, as well as Glendale. And that provides a critical space to really talk through how these cases are being worked, to apply lessons learned, as well as to stay on top of changes that are happening in the community and in the investigative environment. Next slide. So for Child Help Children's Center, Child Help is a national organization, and for all the programs that Child Help administers across the country, the common message that we want children to know is anyone who comes into any of our programs will find love. It's a space that is child-centric, that provides safety and assurance that this is a place for young children to be. Next slide. So as I mentioned, what is critical about a child advocacy center and what has really helped is the foundation of the work that we do at the Children's Center is the co-location of the partners. We're located at 2120 North Central in the City of Phoenix building, co-located with the Family Investigative Bureau of the Phoenix Police Department, while the Child Advocacy Center predominantly works with the Crimes Against Children unit. We're also interfacing with domestic violence, adult sex crimes, missing persons, as well as the homicide unit on a regular basis. The Phoenix Children's Hospital Child Protection Team is located in our building, and that team has over 25 years of expertise in the examination of child abuse, with a team of pediatricians, nurse practitioners, sexual assault nurse examiners, medical assistants. And while they can provide exams for the full age range of children who have been impacted by abuse, it's also a partnership with Honor Health System, who provides the sex assault nurse examinations for the older kids. We also have 2 units from the Office of Child Welfare Investigations, and the Office of Child Welfare Investigations out of the Department of Child Safety is going to be investigating those crimes of abuse that rise to a felony level. So almost every case that comes through our center is interfacing both with law enforcement and Office of Child Welfare Investigations. We have the 2 units, a main unit, but also the training unit. So anyone that is being trained for the Office of Child Welfare Investigations is getting trained out of our building with their team. We work extensively with the County Attorney's Office. And then upstairs is the City of Phoenix Family Advocacy Center, which we have a really strong relationship with, interface with regularly. And then, as I talked about, the multidisciplinary team meeting is really the foundation of the work that we do with a regular interaction of how that team comes together to focus on the needs of that child and the investigative process. Next slide. So just put some pictures together for you so that you can truly see that when a crime is reported, and this is predominantly physical or sexual abuse that is coming through the center, when children and their families are brought here, what children are seeing that this is truly a place for them. It's through the eyes of a child. It's safe, it's child-friendly and welcoming. And the first thing that a child will see is the playroom. So as the family and the partners that are involved in the investigative process are meeting and working through the different aspects of services, we are able to have children go in our playroom and truly be children and engage in activities that are developmentally appropriate, trauma sensitive. These are kids that can be up here from an hour to all day, depending on the nature of what is happening. And so to be able to have a place that allows them to be children and go through the services, but continuously come back to a place where they can be a child is really important. I had I often hear it, but I just heard it last week. I was in the space in our building and overheard a young girl, probably not more than 5 years old, with her mom, and they were getting ready to leave. And the young girl said, "You know, Mommy, this is a really cool place." And her mom paused, didn't really know what to say, because it's not really what she was here for, is not really something that you would define as cool. But for the child to see it in that way, to say, you know, I had to share my story or talk through my story, but to be able to say this was cool is based on the environment that is provided. There's nothing cool about abuse, obviously, but that's not what she felt. That's not what she was feeling. And so that's what the Advocacy Center works to do. Next slide. So I talked already about our playroom, but it's a really important space for free play, being age appropriate, trauma informed, having sensory regulation activities. Kids will come that respond to their trauma being very reserved. Children may be coming very heightened with a lot of behavioral acting out behaviors. And this is a place where we accept any child with however they're behaving or acting, knowing that we can provide safety and support. We have a great partnership with St. Mary's Food Bank, so that allows us to provide snacks and meals for whatever that child needs, as well as often clothing is going into evidence. So we have clothing for them, we can have them bathed and showered, we provide hygiene kits, and our child advocates that are in the playroom are really focused on being attentive and taking care of the needs of the child. And it's truly where the assessment begins, because we can see if children are being reserved, nonverbal, they may have delays, but help communicate things that may not have been seen based on how swiftly and quickly the children may have been brought to the center. So it's starts the place for the assessment and the healing to begin. Next slide. A major part of the investigative process is the forensic interview. We have a team of trained, dedicated forensic interviews at the center. It's a partnership between Child Help, Phoenix Children's Hospital, and the county attorney's office has several contracted forensic interviewers. So this, at any given day, we have 4 to 5 forensic interviewers at the center. And they can be doing upwards of around 4 interviews a day, each of them. So it's a very busy place, and these interviews need to be developmentally and culturally appropriate. They're not asking leading questions, and we make sure it's a soft room so that children are not distracted, but they're all recorded. And we also have service dogs that are able to support the children in the interview rooms. And as the previous slide around the statistics showed, it's a high volume center with a very large number of interviews happening monthly and throughout the course of the year. Next slide. And with our interview room that allows the law enforcement, child welfare, or others involved in the investigation to observe that interview, because the goal truly is to reduce the trauma of the child and to have a child only have to be interviewed once. But it's also with our dedicated forensic interviews, often we have children who are witnesses to homicide, who are coming to the center to be forensically interviewed. We may have children from upstairs that are involved in domestic violence also be interviewed. So that's where we really start to see the interface between the family advocacy and the child advocacy center. Next slide. This is our medical suite through Phoenix Children's Hospital. And again, the design is very intentional to make sure that children are feeling comfortable and allows for the full exam to be conducted here. The children aren't going to Phoenix Children's Hospital unless there's a specific procedure that needs to be done with anesthesia. Most of the exam can fully be completed at the center. No need to go anywhere else, a one-stop shop. They can do the lab work, everything right here. And we have 2 medical exam rooms and the lab through the Phoenix Children's Hospital. Next slide. Another critical aspect, so when the child is going through their forensic interview or their medical exam, is the ability to provide the victim advocacy services and meet with the non-offending caregiver or parent. A lot of times it's the first time that the parent caregiver has learned about the abuse, whether it's a one-time event or chronic. And so it's also talking, listening, and being there for the parent and caregiver. Then it's a lot of repetition. There's a lot of information that goes to a family around the investigation. So receiving that information again, or allowing them to ask questions, sharing their legal rights, as well as what to expect in the next week, the month, coming months, and how follow-up is carried out. Looking at supports, what do they need, and referrals. And as you can imagine, it's primarily around the social determinants of health, often for families, around food and housing. But also a key piece that we hone in on is the therapy and providing those supports for the families. Next slide. Clothing is a huge need for the children that come through the advocacy center. So whether that's because their clothing had to go into evidence, or they're in need of clothing, or because they're going to be taken into custody through the Department of Child Welfare. So we are regularly providing new clothes to children, hygiene kits, shoes, pajamas. Any child that does go into custody, we make sure that they leave with a backpack and items that they can call their own. Next slide. Another piece that we do for the children here, because this is the advocacy center is focusing around the investigative process, is that children leave with a positive memory, and we provide each child a new toy, something they can call their own, and again have a positive outlook on the time that they've spent there. It's always new toys, and we do the full age range from 0 to 18. So it's a big piece of an advocacy center, is making sure that we have these resources of toys to provide to the kids. Next slide. Our advocacy center is accredited by the National Children's Association. And so we have all components, and one of those components is the therapeutic services. And we're considered a specialty clinic with 7 clinicians and 2 occupational therapists to provide trauma-based therapy. That's evidence-based. We have clinical supervision and ongoing professional development. And what is predominantly done with trauma therapy is through play. It allows children to process and start their healing through the process of play. So it becomes really important to have those programmatic materials to allow children to be able to play. So this is just an example of what a room would actually look like, and how children are going through their therapy. We have low caseloads, about 20 children on a caseload for a therapist, and typically children are in therapy from a year to sometimes 2 years. So it's therapeutic services for any child, but particularly for children who have severe trauma and abuse. There's unfortunately wait lists across multiple programs. It's a high need. It's a skill set that we continuously need to find therapists that are able to provide this level of therapy. Next slide. And this is what our occupational therapy room looks like. It's a great combination of services to do the therapeutic behavioral health and then the occupational therapy to really focus on the sensory experience of children, how they're experiencing their trauma through sight, smell, seeing, feeling. And so this blend of therapy has been highly successful in our clinic. Next slide. We always have ongoing needs at the center, particularly around clothing, hygiene kits, journals, craft kits, and toys. And so always look for partners and collaboration. Again, while we are located in the city of Phoenix and predominantly serve a large number of children and families from the city of Phoenix, we're working and serving all law enforcement agencies at our center on any given day. So it's a very strong partnership and collaboration that we have here in Maricopa County to be able to meet the needs, unfortunately, of the large number of children who are crimes of abuse. Next slide. So I wanted to be brief. So I hope that gave you a sense of what the Child Help Children's Center of Arizona provides, along with all of its partners, and happy to take any questions that you have.
Hi, my name's Nikki. I'm with MAG. I just want to know, how do you go about donating items to your organization?
You can reach out to us directly at 602-271-4500 to call and arrange for items to come, or anytime we're open 8 to 5. Someone can come to our building and meet with our receptionist in the lobby to provide items. We're at 2120 North Central Avenue.
Thank you very much.
Thank you.
Michelle, you said that you provide services for all departments. Are all of the various local police departments aware of child help for child abuse victims, to your knowledge?
Yes, in fact, so Queen Creek is the newest city to have its own department that's officially going to launch, I believe, January 11th of 2022. So we provide tours regularly to law enforcement agencies and other partners to give them a tour and see how the services are implemented. And when we do that, we often bring the partners together to have a joint conversation with them.
Okay, and then I have another question, which I can't imagine. Do you find that there are victims that simply because of the workload that you have, that you're not able to provide services to, or do you just make sure that whatever you have to do, you're able to cover all those that are referred to you?
So, great question with a complex answer, unfortunately. So when a case is called in, when a report is made, whether it's reported to through child welfare or through law enforcement, they're going to assign a priority level. So it's a case based on the circumstances where it can be scheduled and worked, or it's an emergent case where it has to be worked immediately. Mm-hmm. So from the investigative standpoint, if cases have to be worked that day, they get worked that day. It doesn't really matter. We fill it in, work it out. But so on the investigative process, it's being worked. But then in terms of the the multitude of services. The victim advocates, because we have 3, we may find that we provide them a brief packet and information and then follow up in a day or 2. So it may not be an immediate follow-up. With the therapy services, that's the hard one. We have a wait list. Most programs do have a wait list. And we're always looking to make sure we have a comprehensive referral list. So if we aren't able to serve the family through our therapy services, that we're able to make the appropriate referral.
All right, thank you. Do any members of the committee have any other questions for Michelle? Okay, thank you, Michelle, for your presentation and your vital work.
I'm
Yes,
sorry, Madam Chair, I did have a question real quick. I know Ms. Michelle mentioned about Chandler. As a council member, Michelle, how can I advocate for the needs that you are experiencing? I heard that you mentioned some needs and things like that. What can I do from that level?
It's always important to be able to, I think, communicate about for families and children and partners to know about the crisis hotlines that exist. And at Child Help, we have the 24/7 child abuse hotline, 1-800-4A-CHILD. Because it's 24/7, and we have text and chat available too, we find a lot of communication is able to happen with particularly youth and teens in a way that hasn't happened before. And then being able to express or share their stories and then be able to connect them in with their needs. I think school districts particularly, but churches, faith-based organizations, nonprofits, being continuously regularly trained and mandated reporter and signs to look for and how to report. They don't have to be investigators. They just need to know if they suspect abuse, how to make that call, and that they should be making that call and not make it overly complicated, because that can hinder an investigation pretty quickly. And then also in terms of needs of recognizing that young children, older children, youth are always in need of clothing items, hygiene kits, therapeutic, what I call therapeutic services or resources, but things such as journals have been incredibly helpful. And just being able to continuously provide those and have those available.
Wonderful, thank you. But if I did a drive based on those items that you mentioned, where would we send that to you?
We're at 2120 North Central Avenue.
Thank you so much, Ms. Michelle.
Thank you.
thank you, Michelle. And Kelly, will we have a PDF of her presentation? Because she did have that list of the needs. Yes.
Madam Chair, members of the committee, the slides from today have been posted to the MAG website under the domestic violence section, along with the flyer from the previous presentation. Further, if you have questions about helping provide supplies or donations to either of these organizations, I'd be happy to help coordinate that.
Okay, great. Thank you. Thank you, Michelle, very much. We appreciate your efforts on this. Look forward to supporting your efforts moving forward on this.
Thank you so much.
This is Samantha from ACES-DB. Can I speak to Councilmember Christine Ellis really fast about her wanting to do donations, or can I email her at some point?
Donations to Child Help?
Yeah, so I'm the chairperson of the Chandler Domestic Violence Commission through the through the mayor's office, and I would love to have more of a conversation about this if you're going to do it in Chandler, and like get the commission involved in that. I think it would be a really great project for us to work together on.
Perfect. Please reach out to me as soon as you can.
Okay.
Thank you.
Thank you, Michelle. And now we will go on to item 7 if there are no other questions or discussion. Okay. On item 7, Domestic Violence Awareness Month. Human Services Director Kelly Williams will share details from the Domestic Violence Awareness Press event that we had and the events planned in October. Kelly, the floor is yours.
Thank you, Madam Chair and members of the committee, and thank you again for your time this afternoon. We have had a successful Domestic Violence Awareness Month already, which is October. Thank you very much for those of you who were able to participate in our press event on September 28th at the Capitol. It was a warm event, but it was also a fantastic and very touching event. Our chair was able to give some lovely words along with Mayor Giles, Maricopa County Attorney Alistair Adele, and perhaps most movingly, we did have a survivor of domestic abuse come and tell her story about surviving domestic violence as an older adult. As you may be aware, this year, MAG has focused with the support of the DV Council to, our efforts on trying to bring awareness to older adult domestic violence. And I don't think there was a dry eye in the house when the survivor was speaking. She was a very moving speaker, and we were thankful for her courage and bravery to get up and talk about her experience, and also how she was able to find services through the DOVES program here in our region through the Area Agency on Aging, and encourage others to be able to use those services, especially older adults. I would also like to thank your participation in our October calendar of events. It is also found on the MAG website, and it is up to date with lighting events across the region. As you know, purple is the color for this month, and many of our public buildings have been are shining in purple light to celebrate domestic violence awareness and to bring more attention to this social issue. We also have a pretty robust list of webinars, different trainings, speakers, etc. You may have heard our colleague Laura Guild from DES share that she was on her way up to Payson because this evening they're doing a Lanterns on the Lake event, which sounds really remarkable in honor of individuals who have experienced domestic violence. So it is not too late to get your events in. If you're still interested in participating, we continue to update the calendar. You can feel free to send those to me directly, or we do have a form available on our website also for submission. And if you're on our website, you can see photos not only from the press conference, but also photos that have been sent in from our stakeholders across the region who've had events. They've sent us photos of their buildings that are lit in purple in the evenings. They've hosted days where all the staff wear purple to bring attention to this social issue and have sent us staff photos. There's a really nice collection as well. If you're interested in having an event, any day in October is a wonderful time to have a staff purple day, but October 21st, I wanted to bring to your attention, and 2 weeks from today is National Domestic Violence Day. And we would encourage you to wear purple that day and talk about it and share your passion for this topic with others. Further, I just wanted to conclude my remarks today by thanking our chair, Councilmember Norton, for attending the Pinal County's Domestic Violence Conference last week and being an active participant in the day-long conference. It was wonderful to see representation from our council at the conference and to learn from our colleagues in Pinal County. And with that, Madam Chair, I thank you, and I'm available for any questions.
Thank you, Kelly. Are there any questions or comments for Kelly? Yes, Bandon, I don't see your full name there. Do you have a question?
Thank you. Actually, I was just giving her a thumbs up because the event was really nice. Well done. That was my first time going to an event like that. And just the words that were shared, the sentiment, it was just really great. So I really appreciate all the work that was done to get that put together. Thank you.
Thank you. Was your husband the photographer?
Yes, he was.
Okay, all right. Thank you. That was very nice of him to be out there. All right. Any other comments? Okay. All right. Thank you very much, Kelly. And let's go on to item 8, request for future agenda items. Are there any requests for future agenda items or topics of interest to this council?
This is DC. Based on our minutes from our last meeting, I think Andy had offered to present on AZ Post. So I don't know if we can see if he's still able to do that.
We don't have that actually posted. Now, can we can we cover that, Kelly, under comments? Okay, so when we get to the comments from the council, we can have Andy present
Sorry.
on,
Thank you.
correct? Okay, Mary Lynn?
Or Madam Chair, we can invite, excuse me for interrupting, we could invite that individual to come back and do a presentation at a future meeting. It's up to your decision.
Okay, is Andy here? Is he on?
I don't believe so, Madam Chair.
Okay, all right, so we'll invite him for the next meeting. All right, thank you. And Mary Lynn, did you have?
Since you all enjoyed, well, you know, enjoyed or were moved by Marie's story, I didn't know if you would want staff to come and just talk about, just give a brief overview of the DOVES program and all that they offer for victims, survivors who are age 50 and over.
Thank you, Mary Lynn. I think that would be great to add to the agenda for our next meeting. I'm in fact going to be going out next week to their center to tour and get more information. And so I think it would be great for them to do a presentation. Very helpful to know all the ways that they help victims of domestic violence. So yes, thank you. We will put that forward and invite them and see if they can make it. I kind of think they'll be able to. So thank you. Any other suggestions or requests for future agenda items? Okay, hearing none, then let's go on to item 9, comments from the council. Members are provided an opportunity to share information and updates for information. This is for information only. Any action proposed will be slated for a future meeting. And so if there's anyone that has comments that they would like to present, now's the time. Things that you're going to be doing in your community for Domestic Violence Awareness Month or others. All right, I'll start. I did attend, there's 2 things I want to mention. I attended the Pinal County annual domestic violence conference, and I was I felt that I've known a lot about domestic violence, but there was information provided there that just really emphasized the other seriousness and how it literally is a life and death situation for many people that face domestic violence. And there was something else that I thought it came through, and I was very impressed. I know many people in society, they question victims and survivors. And I think the number one question those who have not experienced domestic violence have is they always say, why didn't they get away? Why did they stay? Why didn't they leave? And this conference covered so much. There was so much information. We had a psychologist, we had a doctor with all kinds of degrees, and explaining how the brain worked and so forth. And one of the things, big thing that comes out of that is having an understanding of just how we are designed, how the brain is designed. And we all, it's not just one person or that victim. We all could fall victim to that and have similar responses. So I think that what was learned in that was tremendous. And I'd like somehow that we can get some of that information and perhaps share it on the website because it's vital information. I think it helps, it would help all of us to understand more and also understand the seriousness and be able to encourage others to seek help because it can be a life and death situation. And then the other thing I want to mention is this month in the city of El Mirage, we are having our first social event since COVID broke out last year. And that's our fall festival, which is Friday, October 29th. And we will be having a booth with the El Mirage Cares program, and the emphasis will be on domestic violence. And one of the things that we'll be doing is we have these spin wheels that you spin, and in some places you get a prize. We'll be having two, and one will be on domestic violence, on the various signs of domestic violence. And then the other spinner will be on the signs of a healthy relationship. I'll submit pictures once we've had the event and report back how that goes. But the goal on that is to raise awareness and get people to thinking not only about what the signs are, but also what the signs of a healthy relationship are too. And I think that all goes together. If you kind of know what a healthy relationship should be like, it might help you to see and evaluate what kind of relationship you're in. So that's something that City of El Mirage is doing as part of Domestic Violence Awareness Month. Does anyone else have some comments to offer?
I just wanted to talk about the Pinal County. So I was the co-chair of that event and also presented. So if there's any information that you need, please contact me. I'll try my best to get you whatever you need to support adding it to the website or whatever you're looking for. If you want, Dr. Wilson's information or Shafali's or anybody. So
will do, Samantha. Thank you.
Thank you.
Okay. No other comments? Okay. Hearing none, then I guess we are adjourned. And forgive me, I think we missed the roll call at the very beginning of the meeting.
That's okay, Madam Chair. We were able to establish through roll call through the quorum.
Okay, very good. All right. Thank you. You all have a wonderful week, and we'll see you next month.
Okay. Thank you.
All right. Bye.
Thank you, everybody.